So I am Dr. Nelva Lee. I am the CEO and founder of MiTio. And in this presentation, I'm going to go over our innovative language solutions and our DEI optimization. So I'm going to ask a few questions and see if you find yourself in any of these. Does this sound like you? You've been told by outside agencies or outside organizations that you need to hire a specific percentage of diverse individuals, whether it's Black, Hispanics, Latinos, Asian, you name it, right? Women have some sort of balance, diversity numbers balance in your organization. How about this question? Are the minorities in your company, to include the women, complaining that they don't have a critical mass, that they're not really part of your community? Do you advertise for qualified minority employees? But most of the applicants that you find after you do the interview, they don't really fit your company culture. How about when you interview and hire minorities into your company, they're not really engaged, right? They're not really part of the company. Do you work feverishly at recruiting diverse individuals, but find that hiring them, they just don't meet your qualifications? Are you being told by both employees and outside groups that your company culture is toxic? This we find in a lot of like tech organizations or organizations that are very male led or heavy. Are you having difficulty engaging with your diverse employees who are in remote settings? Are you working to hire and retain a diverse workforce and wish that you had a guarantee for your efforts that would last? Do you feel like every year the cost of recruitment and retention of qualified diverse staff just keeps rising? And do you want to reduce these expenses for your company, but still hire the best? Do you feel like there's an invisible ceiling on the amount of qualified diverse staff that you can reach or hire each year? And do you feel like you're ready to outsource this assessment, analysis, consulting, and training of your diverse staff, but don't know where to start? So the real problem is that you're stuck in the old mindset that you have to do everything in-house, right? But we want you to look into the lucrative new model of partnering with a comprehensive diversity and inclusion consulting service. So once you move to this new model, you will know how to navigate diverse hires, especially the blind spots. You will be able to easily assess your areas of greatest need and improvement, and you'll be guided step by step in ways to improve your diversity and inclusion within your organization and retain these improvements long-term. Also, you'll have that invisible ceiling. It'll go away, it'll disappear because you're going to be able to engage with your employees and you'll be able to give them critical mass. You will attract and retain the qualified diverse staff that you're seeking. And you'll be able to do all this with our turnkey system here at MiTio Consulting. So some of the solutions that we offer are upskilling and certification of diverse workforce and optimization of these of your DEI efforts, okay? So as I mentioned, I am the CEO and founder with over 20 years of experience. My background is actually in healthcare administration. I was the director of Grady Health System a director of patient advocacy at Grady Health System. And I basically created this program out of the efforts that I found there. So here are some of our consultants. I'm not gonna read all of their bios for you, but we do have some amazing qualified individuals that work alongside myself. Dr. Pei Zhang, she's a CMI certified Mandarin consultant. Jonathan Logan, who is a certified Italian, Spanish, and Portuguese CMI certified consultant. Tatiana Ford, who is our Russian certified consultant. You got Lily Drisdale, who is our Spanish and French consultant. Cindy Mata, who is our certified Spanish consultant, and Nee Clark, who is our certified Vietnamese consultant. So here's a little bit of an overview of what our process looks like. So when you come on board with us, we will do a pre-assessment of your entire staff, everybody in your organization, top to bottom. Then we will train that staff on our culture gap. And I'll explain a little bit more on what that is. It's culture mapping and generational gap training. Then we do a deep dive in the different groups that is identified in that assessment. And we do focus groups with those groups. And that's one of the reasons why organizations hire us, is because they're able to be able to outsource that portion, because their employees feel more comfortable oftentimes talking to someone that's not in-house, right? And then we'll be able to really look into the challenges that your organization may have or may be presenting around the area of diversity, inclusion, engagement. And then we set up these amazing SMART goals with the leadership, and we look at the post results, post assessments, to see if we've been able to hit those targets. And then we do these assessments on a periodic basis. So here's a little bit about some statistics that you're probably familiar with. So 1/3 of new employees quit after just 6 months on the job, all right? 3 to 4.5 million employees quit their first month, okay, quit every month. And there's 75% of the employees give reasons that they are leaving their jobs, and most of those reasons are preventable, okay? So with MiTio, our retain process is all about retention, engagement, training, assessment, inclusion and diversity, and networking. And we'll explain a little bit more about that. A few more statistics. Employee turnover has increased 60% in recent years. You've probably heard of the Great Resignation, right? And so really and truly that you should be hitting a target of 20%. That's the average turnover rate. But good organizations have a 10% turnover rate. And MiTio will help you reach those goals. It usually costs anywhere between 33% to 50% of an employee's salary to replace them. Okay, so those are the hard costs. The average cost to rehire a new employee is about $4,000, $4,129. So obviously, keeping your good employees is important. It's actually essential for your bottom line, right? So when employees don't feel valued at work, 76% of them will look for another job opportunity. 94% of surveyed employees responded that if a company invested in helping them learn, they would stay longer with that company. And 60% of those employees decrease retention rates if they're not able to give upward feedback. Okay, so those are some of the importance of valuing employees. So let's look a little bit about training and assessments. So one of the things that MiTio does is it does the culture map courses. All right. So as I mentioned earlier, this is proprietary, but it's available to any employee when they your entire organization. It's part of the assessment process. So we provide you with the pre-assessment, and then we provide your entire organization with the culture map course that really helps them navigate and understand various cultural groups within their organization. We also offer as a bonus translation courses. So we have a DEI program that is also a sister to our other deliverables within our organization, which is interpreting services and translation services, interpreting courses and translation courses. And we find that employees that are able to obtain training, really it improves their loyalty to your organization. So that's one of the things that we will offer you as a bonus is translation courses to your bilingual staff that may want an additional certification. And lastly, the analysis that I mentioned that we do. So that pre-assessment comes with an analysis and an analysis report, and also our consultants will then come in using that analysis to set SMART goals for your organization. and see specifically where we need to target those focus groups. So inclusion, diversity, and networking is really the way that you're going to engage your employees. So this ensures that everyone is heard, respected within your organization. It also allows you to have regular surveys, and these are anonymous surveys, but it allows you to have regular surveys to see if you're meeting those targets. And you can train specifically for diversity and inclusion. I'm pretty sure that you've had lots of different trainings within your organization, but is it specific to this area of diversity and inclusion? So I'm going to give you a little bit of some of our case studies. Wellstar Hospital, right here in Georgia, they trained over 100 of their diverse staff through MiTio. And this is just a picture of them with their certificates when they obtained their interpreting and translation courses. Okay, so just a little bit of a background on Wellstar. It's one of the largest health systems in Georgia. They reached out to us to obtain DEI interpreter training for their bilingual staff. And the results was that it really improved the engagement and retention of those bilingual staff. Memorial Health also did the same. They trained their staff through MiTio. And their background is that they want to provide a culture of caring for both their patients and their colleagues. So one of the things that we found was that when they partnered with us, they were able to convey that to their bilingual staff. And again, their graduates really felt engaged and heard in their organization. That's just the start. Really, over the past 19 years, we have trained over 2,000 diverse staff through our program. We know what to look for, and we know how to get the results that you need. So here are the 7 steps to obtaining comprehensive consulting services with MiTio. Number 1, stop focusing on your diversity numbers. I know it sounds counterintuitive, but you really need to just start looking more at inclusion. Really focus on inclusion, and the numbers will basically follow. So studies have found that our brains are wired to believe that others threaten our survival. So if you're looking at diversity numbers, that's an otherness, right? Changing a hardwired behavior is difficult at best, impossible in most cases. So the inverse is that we're also wired to spot equity, lack of inclusion as a threat to our survival. So leaning into solving for the equity issue actually automatically solves for the diversity problem as well. Equity is easily achieved when we set a goal towards it, back to those SMART goals that we were talking about, when leadership is 100% behind it, and you set an approved timestamp, okay? So something that's very measurable, but a time component to those goals. Another case study is Ochsner Healthcare. They train over 20 of their diverse staff through our program. Ochsner is a 501c3 nonprofit organization, and they basically reached out to MiTio because they wanted to train their DEI staff through us, and we were able to train their staff and improve their retention rates in their organization. Another case study is Maryland, University of Maryland Medical System. They trained over 16 of their diverse staff through MiTio. And similar to Ochsner, it's a nonprofit corporation. It's based out of Maryland, and they really wanted to make sure that not only were their patients' voices heard, but also their bilingual employees. And we were able to find success and improve their retention rates in their organization. Step number 2, you have to uncover your blind spots. Okay, so believing that you understand each individual culture of your diverse staff is the first mistake. So you really have to uncover the blind spots that you might have. And that not only do diverse staff come with their own set of cultures, but with their own set of challenges to overcome. And so you have to lean into learning and embracing the cultural differences and the challenges. That's the first step, okay, to building a more robust organizational culture. And studies have found that whenever you have diverse cultures interacting on projects, the results are more creativity and productivity than produced by just homogeneous groups. So you want to have these diverse groups and cultures in your organization. So you put in the work initially, but the payoffs are huge. Another one of our case studies, ALO Health. Amy Huber says the quality of the and work of customer service support that MiTio provides to our patients is some of the best that we've experienced. Everything has been smooth and phone calls have been responsive and professional. Super convenient for a busy family practice such as ours. In times such as these, we find that anything that we can do online or from a distance is an easy mechanism to work with our patients' communication. And so what we were able to provide to ALO was on-demand interpreting services. As I mentioned, we provide interpreting and translation services in addition to our diversity and equity and inclusion consulting. And we were able to provide these virtually in over 200 languages in as little as 20 seconds. Heartland Alliance, another one of our case studies, they trained over 50 of their diverse staff through our programs. And they were able to find that their trained staff had improved satisfaction rates with their organization. Step number 3, eliminate unnecessary barriers. So the way that we have always done it is the best way to remain in the past. So you have to be constantly updating and changing the way that you do things. And if you want to be inclusive and encourage engagement of your diverse staff, finding new ways to do business is essential. The smallest, seemingly innocuous process could be a major barrier to engagement with your diverse staff. So you really should be ruthless about finding out what these unnecessary barriers are and eliminate them. Those are the easy wins I find. So pivoting externally with market demands obviously is essential to remaining in business, but the same is true about pivoting internally with your employee demands. That's going to help you remain and retain this excellent talent and improve your bottom line. Another one of our case studies, the U.S. Oncology Network, they trained their diverse staff through MiTio. And it's a lung cancer organization. They believe in empowering and delivering advanced integrated cancer care throughout their network of independent physicians. And they reached out to MiTio to train their bilingual staff. And we were able to do that, and it was a success. It improved the retention rates of their diverse employees while reducing liability. Land Consult is another one of our case studies. They're actually out of South Africa, and they train their bilingual staff through our program. So they reached out to us, as I said. They are an organization based out of Cabo Verde, and we were able to train all of their bilingual staff. We were able to make some tweaks specifically for the culture of South Africa, and their trained employees were able to remain with their organization, and it improved their retention rates. Step number 4, set SMART goals for diversity and inclusion. So here's some, you all know what a SMART goal is, right? Specific, measurable, achievable, realistic, and time-bound. So I talked about a little bit about this earlier, but we usually take those analysis and those reports, and we go at setting very specific goals for your organization, whether you want to hit that 20% average turnover rate or that 10% for the best companies, but it needs to be measurable. We need to be able to have a specific measurability to that. So we need to have a starting point, obviously. And it needs to be achievable. We're not about setting unrealistic goals, but we are going to tell you what the best practices are, and based on your organization, what are some achievable goals that you can reach. They need to be realistic. Okay, that goes to the achievability of them, and time bound. That's really the key to hold yourself accountable, and have your, not only the top leadership hold themselves accountable, but the staff holding you accountable as well. Another one of our case studies is Cardiovascular Clinic of North Georgia. They not only use interpreter services, but actually translation services with us as well. So they cover over 200 languages in all of their different locations, and they're able to use our virtual platform that's both video and audio to provide over 200 languages to their patients. And actually, it helps improve the staff morale as well. You're not using ad hoc interpreters. You're not using staff that aren't really trained as interpreters. So you're using professional interpreters to provide this service. And it improves patient as well as employee satisfaction. Step number 5, properly assess the diversity and inclusion gap. So if you don't know where you started, where are you going to go? How do you know if you got there? So assessment uncovers the blind spots and the unnecessary barriers to inclusion. And once properly assessed, the company and its leadership can then make detailed and specific plan to achieve those goals. So assessments must be done at the end of the process as well as the beginning of the process. You want to be able to see whether or not you were able to meet your goals. And with our consulting services, we do them every 3 to 6 months. HealthLink has trained over several of their diverse staff through MiTio, over a dozen of them. And they have found that it has helped their organization with their retention rates as well. Step number 6, thoroughly analyze the assessment, okay? So you want to make sure that you have not only assessed all of your organization, but you want an analysis and a report that really helps to really pinpoint the areas within that assessment that you need to solve, okay? And that's one of the things that you will partner up with one of our consultants, and it's all data-driven. And so that's really the key to setting lasting improvement. Aviator Home Health felt that we met their need for occasional interpreting. So one of the things that sets our interpreting services apart is that there's no monthly payments, there's no annual payments. You just pay for the calls that you make. And so it makes it very affordable for small organizations as well as large ones. And we improve their patient satisfaction rates in the process. Step number 7, consulting and training for an inclusive culture. So after you have identified your gaps, your blind spots, your barriers, you have analyzed everything, and you've developed your SMART goals around the data. Now you can begin training your staff. So we've talked a little bit about our culture gap course that we have everybody within your organization go through. And that really prompts and it really helps inform the focus groups. So it really helps your organization all be at the same level when it comes to understanding how to navigate different cultures within your organization. So it's imperative that you have peace of mind in the diversity and inclusion process that you put in place. And therefore, we have a 30-day guarantee on all of our consulting services. So if you don't hit the targets that you have, you don't have to do work with, continue working with us. So you have 2 options at this point. You can continue with your failed diversity and inclusion efforts, or you can obtain consulting and training for your diversity inclusion with our turnkey system. So if you would like to have another demo of specifically a demo of our services, of our program, I would love to meet with you on a one-on-one basis. Now, Ms. Angela, you are the only one on the call right now. So do you have any questions for me?
I appreciate the presentation. I just wanted to get a feel for what will be offered. We're a school district, and as you mentioned in your presentation, we're